Welcome everybody to the 39th Annual Northwood University Freedom Seminar. I'm so glad to see so many of you come out for tonight's event. And I promise you that if you enjoy tonight's event, there are many others coming up that you will also enjoy over the course of the weekend. I want to tell you a little bit first about the Freedom Seminar, give you a little bit of background, and give you a taste of what to expect as we kick this off tonight. So, our university was founded by two educational entrepreneurs, Gary Stauffer and Arthur Turner, and they believed strongly in the core values of ethical entrepreneurship, individual responsibility, and freedom. Then, as now, Northwood retains an institutional commitment to these core values and to communicate them to our students. And the Freedom Seminar is one of the ways that we deliver on this commitment. The theme of this year's seminar is called Freedom Works. A strong work ethic is an important part of the Northwood idea. And not just because our work generates income. We value work because it provides us with an opportunity for personal development and for service to others in our community. For most of its history, the United States has been a job-creating machine. But increasing regulatory burdens on employers, intense global competition, technological change are creating a challenging work environment in the future. The ideas that our speakers will share with you this weekend will inform, inspire, and equip you to take advantage of the opportunities that this new economy presents. A complete schedule of events is available on our website at northwood.edu/freedom-seminar. And I also have some copies of the event. If any of you want to pick up a paper copy of the other events that are, other presentations that are happening this weekend. At this point, I want to express my appreciation to Tim Nash and to the McNair Center for Enterprise and Entrepreneurship. The McNair Center is a think tank based right here at Northwood University, which is focused on the advocacy and expansion of free market economics and the creation and cultivation of entrepreneurs. So now moving on to tonight's speaker. We're going to begin our program with a presentation about public policy that has played a pivotal role in this year's past presidential election. It seems like it's making new headlines on the news almost every night. And it's about the continuing effort to reform America's broken healthcare system. While spending more than any other nation, we have managed to create a system which stifles job creation, puts our businesses at a competitive disadvantage, and yet leaves millions of Americans uninsured. Surely we can do better than this. And no one understands that better than tonight's speaker, Mr. Michael Tanner. Mr. Tanner is a senior fellow at the Cato Institute. For those of you who are not familiar with the work of the Cato Institute, I highly recommend that you visit their website and become familiar with their work. Cato Institute is an organization dedicated to the principles of individual liberty, limited government, free markets, and peace. And Mr. Tanner has led Cato's efforts to advocate significant reforms in our entitlement programs, including Social Security privatization and healthcare reform. He is the author of numerous books on public policy, including Going for Broke, Deficits, Debt, and the Entitlement Crisis. Also, Healthy Competition, What's Holding Back Healthcare, and How to Free It. And lately he's been working on the issue of poverty, and he has written The Poverty of Welfare, Helping Others in Civil Society. In addition to these books, his writings have appeared in nearly every major American newspaper, including the New York Times, Washington Post, Los Angeles Times, Wall Street Journal, and USA Today. He's a frequent commentator on cable news programs and he is also a frequent visitor to Northwood University. I think this is his 4th time at our Freedom Seminar, and we really appreciate him coming back. I hope you will help me give a warm welcome to Mr. Michael Tanner.
Thank you very much, and I appreciate you having me back. I couldn't miss this weather. I mean, I just couldn't stay away from it. I should note that if any of you are tweeting this, my hashtag is @InTannerCato for anybody who's tweeting out there. Whole new world. We didn't have this when I started. It was very different. But I always enjoy these events very much, and I'm going to try to keep my remarks fairly short so that we can get to the best part of it, which is the Q&A, and letting you folks get some participation and get to rant at me or throw things or whatever you're going to do, or ask questions and things like that. But I want to talk to you a little bit about what's going on right now with the efforts to replace, or to repeal and replace, as the phrase goes now, the Affordable Care Act, or otherwise known as Obamacare, in Washington these days. Now, I actually didn't know if I was going to be here because this should have been all done. I mean, I was personally assured by the president that health care is easy. And that there was no problem at all. They were going to replace it with something really, really beautiful. So we wouldn't have to worry anything about it in the future. But somehow that didn't come off. Republicans had only 7 years to think of a plan and didn't quite pull that off. So here I am. And let's go back, if we can, and start, say, at the very beginning here, about a little bit about why we're in this whole question of repealing and replacing the Affordable Care Act. I mean, what has actually happened with the Affordable Care Act, and why is it so difficult then to deal with right now? And one of the things we should start with is one of the things that the Affordable Care Act actually did accomplish. The Affordable Care Act expanded the number of people who have health insurance. And there's a lot of different numbers out there. Congressional Budget Office says it's about 20 million. Rand Corporation puts the number more like 16 million. But somewhere in that area, well, let's go with the CBO numbers and say 20 million Americans have health coverage under the Affordable Care Act that did not have it before 2010, before the Affordable Care Act passed. And that really is something of an accomplishment in a way. Now, I want to throw a few caveats on that, if you will, because if we look at that 20 million people, it turns out that slightly more than half of them don't have health insurance. What they have is Medicaid. And Medicaid coverage is nowhere near as good as actual health insurance coverage, and in many ways, Medicaid coverage is almost like having no coverage at all. It's kind of the magic formula for healthcare reform, if you will, in which I give you a magic piece of paper that says, now you have an insurance coverage, and you know, if you wish real hard on this piece of paper, then the dumb doctor will come to your house at night and treat you, or something like that. Unfortunately, magic doesn't really work, and neither does Medicaid for a whole lot. There's several studies out there that show that there's very little difference between Medicaid and being uninsured. Perhaps the best one of these came out of Oregon. Oregon actually had the chance to do what's sort of the gold standard of scientific inquiry, which is a random assignment study. They had a situation where they had a certain pot of money and more people applying for Medicaid than they could actually put in the program with the money they had. So they conducted a lottery among the applicants, purely at random. You were either got Medicaid or you didn't get Medicaid, purely as a random consequences of this lottery. And then they were able to compare the two groups, the people in Medicaid and the people who were not, who have very similar characteristics of the same general populations demographically, and they were able to compare results between the two. And one of the things they found was they said, okay, the people who had Medicaid actually had greater utilization of healthcare. They went to the doctors more often. Interestingly, they didn't go to the emergency room any less, which was one of the complaints that people without health insurance always went to the emergency room to be treated rather than go to a doctor. People on Medicaid continued to go to the emergency room, they just went more often because Medicaid was paying for it. They also found this sort of psychological benefits from being on Medicaid. People were less worried about what will happen if I get sick and can't pay the bills, so there was kind of a general satisfaction benefit. But when they actually looked at health outcomes, what happened, things that were measurable in terms of did your health improve, they found there was no difference whatsoever between the two groups, between the people on Medicaid and the people who were not. So apparently being on the Medicaid didn't actually do anything to improve people's health or give them better health outcomes than being uninsured at all. Now, this was only a study over the first 3 years of the program, and we will have to find out what happens when people are 5, 6, 7, 10 years down the road. But initially, it looks like they're not getting a whole lot from Medicaid. So when supporters of the Affordable Care Act talk about the fact that we covered 20 million people, remember about 11 million of those folks are in the Medicaid program, and their coverage is kind of right? But even if you count that, some other people did get coverage that wouldn't be covered otherwise. About 3 million folks who are your age can stay on their parents' policy until they turn 26, when that wasn't the case before. Now that's not all new coverage. About 1 million of that 3 million actually had health insurance in other ways, and now they're just going on their parents' coverage, so it's not necessarily 3 million additional people, but a couple million are getting coverage that weren't getting coverage before. This, by the way, was hugely popular with parents until they found out that that coverage wasn't actually free. That if the insurance companies are going to continue to cover you folks until you're 26, they actually make your parents pay more for their premiums, or their parents' jobs pay more for their premiums to do that. But still, that's very popular. And we shouldn't knock down the fact that some people who didn't have insurance before, didn't have access to insurance, have gotten it. But we also should recognize that this expansion in coverage has come at a price. It has come at a price in terms of higher premiums and higher costs. If you actually look back since 2010, and I'm talking largely now about the individual market, not the group health insurance market, but the individual health insurance market. That's small businesses and people who buy health insurance on their own primarily. And the small group and individual market, since 2010, premiums have roughly doubled in that market. Last year alone, premiums in that market went up on average 25%. And this is for what's called the baseline silver plan in the plan. So it's the second most inexpensive plan in that market. What they use for the baseline, and that went up about 25% last year. It's gone up about 100% since the program began. And at the same time, deductibles, co-payments, and co-insurance under these plans have all risen substantially as well. Today, for a family of 4, the average deductible is about $16,000 in addition to the cost of insurance, in addition to any co-payments you have and any co-insurance you have. So you can end up paying out of pocket for a family of 4 over $20,000 before you even get to use the health care plan that's gone up 100% in price. So that's a significant cost. It's also come at a cost and decrease of access to the doctor of your choice. A lot of insurance companies, in order to stay solvent, and I'll explain why that's the case in a moment, but what they've done is they've cut back on their network of doctors and hospitals that they cover within their plan. They're shrinking their networks down, and that may mean that the doctor that you wanted to go to, if you had an OBGYN, let's say, that you like, that doctor might this year no longer be covered in the insurance plan that you were in. And you might have to try to change plans around to keep coverage with who you wanted. And a lot of the plans that no longer cover, for example, some of the big centers of excellence. For example, in New York State, for example, there is no longer a plan on the exchanges that covers Sloan Kettering Hospital, which is one of the best cancer centers in the U.S. So you'd have to pay out of pocket or out of network costs in order to access that. And then finally, one of the things that's driving this is that the Affordable Care Act is teetering on the edge of what's called an adverse selection DESFire. And this is very important because this is sort of driving the whole debate right now. It's driving some of the other problems I just talked to you about. And it's also what is screwing up the Republican plan to replace the Affordable Care Act. And that is, if you want to think about what is the original sin of the Affordable Care Act, what is the fundamental problem with the choice they made in designing the Affordable Care Act that basically made the whole thing fall apart? And a lot of people you talk about, people say, what's the worst thing about the Affordable Care Act? A lot of people tell me, well, it's the individual mandate. It's the fact that I have to go out and buy this lousy insurance. And then people talk about, well, no, it's the business mandate that requires small businesses to buy insurance and therefore makes it difficult for them to hire employees. Others will talk about the subsidies. You have these huge subsidies in the Affordable Care Act that, when we have a $20 trillion national debt and $100 trillion in unfunded liabilities, we're paying these huge subsidies, both to individuals and insurance companies in the Act. And people complain about that. But the actual problem, the thing that's driving all the problems in the Affordable Care Act was the decision to say that insurance companies could no longer discriminate against people with pre-existing conditions. That insurance companies had to accept everybody who applied to them, regardless of what their health was, and that they could not charge people who were sick more than people who were healthy. Now, when we talk about a pre-existing condition, let us remember what a pre-existing condition actually is. A pre-existing condition is somebody who is already sick. It's a little bit like being able to drive your car into a tree and then picking up the phone and saying, hey, Geico, I'd like to buy some retroactive auto insurance that'll cover me for this accident. I mean, people who are already sick are by definition uninsurable. What they are buying is not insurance, which is about spreading risk. What they are buying is you're paying for their health care now. They don't belong in an insurance market. Now, we can talk about ways to pay for their health care, but there is no way to insure something that has already occurred. I mean, what is insurance? Insurance is ultimately a risk-neutral company dealing with a risk-adverse individual. Let me give you an example of this. Let us assume that there was some event that had a 1 in 10 chance of occurring. And if it occurred, it would cost $100,000 if it occurred. And if every year there's a 1 in 10 chance that that might happen. There's no difference technically between buying a $100,000 insurance policy. If you do that, an insurance company is going to charge you $10,000 every year for that policy. So that when the 1 in 10 chance happens and they pay up $100,000, they don't lose money on it. They're going to actually they'll charge you for the profit. You probably have to pay $11,000 for that insurance policy every year. Or you could not pay that insurance company, simply save that $10,000 you're going to pay in premiums, put it in the bank, and then when the accident happened to you, you could pay that $100,000 yourself. You're in exactly the same circumstance, set of circumstances, if you do that. The difference is, as an individual, you're worried about when that insurance, that accident might happen. What if it happens in year 2 and I haven't put that money away, right? So you'd rather pay the $11,000 to the insurance company rather than put $10,000 away every month, every year for yourself. The insurance company doesn't care. They've got enough different people coming in and paying that $11,000 that if it hits on you in any particular year, they can pay you. But when we're talking about pre-existing conditions, we're not talking a 1 in 10 chance. We're talking about a 100% chance. We're talking about that $100,000 is going to happen this year. And I can't charge that person $100,000 for insurance. I can only charge them $10,000. I'm guaranteed to lose $90,000 on that person. No, so we're not talking about insurance. Once you make that decision that I've got to cover that person who's going to cost me $100,000, and I can't charge them any more than I charge somebody who's not going to cost me that $100,000, the insurance company basically says, in order to be able to do that, I've got to go out and find a whole lot of people who are not going to cost me $100,000, and I have to charge them $10,000 each. I got to find a lot of healthy people who I can rip off essentially for big premiums in order to make them pay for that person with a $100,000 cost. Unfortunately, what we find out is that a lot of young healthy people don't want to pay $10,000 for a policy they're not going to need. So if we do that, then we have to force those young healthy people like you to buy policies. So we have an individual mandate to make you buy the insurance. And then what basically happens politically, if we're going to make you buy insurance, we have to say, what is insurance, right? I mean, pretty sure that, having had mandated that I buy insurance, that policy with the $10 million deductible that I bought for $9.95 at Walgreens, that's probably not going to cover it. So what they do is they then say, well, you have to buy insurance, and it has to be this type of insurance. It has to include these benefits. It has to have this deductible. It has to have all these other things in order to qualify for the type of insurance that's going to meet the mandate. And of course, this being Washington, every special interest in the world shows up at the door and says, it's not really insurance unless it covers my disease or my specialty or my provider, whatever it might be. So, the chiropractors have to be in there, and the acupuncturists have to be in there, and the chemotherapists. I mean, everybody has to be part of it. Well, that drives up the cost of that plan. Now it's no longer a $10,000 policy. Now it's a $15,000 policy. Well, we can't make you buy that $15,000 policy if you can't afford it, so we'll have to subsidize it for you. So instead of making you pay $10,000, we'll only make you pay $5,000, and we'll make the taxpayers pay the other $10,000. Doesn't make the policy any cheaper, it just shifts who's going to have to pay for it. But as you can see, all the other bad things about Obamacare, the mandate, the essential benefits package, the subsidies, all stem from this one problem of having decided that they're going to take people who are uninsurable and try to insure them. Then you get into what I mentioned earlier, which is called the DESFire. And what's happening with the Affordable Care Act is that despite the mandate and despite the subsidies, they still couldn't get you to buy that policy. It turns out that young, healthy people wouldn't buy a crappy insurance policy even if it was subsidized. So what we ended up with is if you were sick, if you were that $100,000 person, oh, you rushed out right away and bought the policy. I mean, why not? If people who couldn't get plans before, people who didn't have insurance before because they had cancer or whatever, they went down the first day and signed up. They bought their policy. But healthy people said, hell no. And the pool, what's called the insurance pool, the people who were insured ended up to be very sick and very old. Young, healthy people just didn't participate. Well, if you're an insurance company and all the people who are buying insurance from you are old and sick, you've got problems, right? So they did a couple of things. One is they shrank their network so they have fewer people to pay, and you got rid of the really good doctors. I mean, if you're an insurance company and you can't discriminate on against somebody who's got cancer, do you really want to have the world's best cancer doctor be part of your network? So that everybody who's got cancer signs up with your plan? No! You want one cancer doctor, you have to have one. So you've got one, and he's out somewhere in the mitten up there, and he only has office hours on Tuesday from 10 to midnight. It's the only guy you're going to sign up. So they shrank their networks and dropped off centers of excellence, the Sloan Ketterings of the world and places like that. Or they raised their premiums. On the people they did have, they said, okay, we're going to have to just charge everybody more for insurance. That'll help us. Or they got out altogether. United Health pulled out of the market. Humana pulled out of the market. Just read an article today saying that Anthem is thinking of pulling out of the market next year. They just said, we're not going to, we can't make money in this market, we're just out. We're just going to pull out. Well, if you're faced with that, if your network's shrinking, the people that you used to be insured with went away, and your premiums went up, what happens is the healthiest people in that market say, this isn't a good deal for me anymore, I'm getting out. So the next healthiest group in the insurance market simply drops out of the insurance market and stops playing games, stops playing it. That means that the pool shrinks, and the people who remain in it are still sicker and older, because the younger and healthier people got out. That means insurance companies look at this again, and they go through the whole process again. The premiums go up, the networks shrink, companies pull out, the people drop out, the next healthiest group drops out. Pool shrinks more, and this goes on until eventually the entire insurance market collapses in flames. That's what's called the adverse selection death spiral. And if we weren't already in it with the Affordable Care Act, we were teetering right on the edge. As you can see, the premiums were rising, the companies were pulling out, the networks were shrinking, people were beginning to drop out. We were heading into that adverse selection death spiral. That's why we had to change the law. That's why the Affordable Care Act cannot continue. It is collapsing of its own weight, and it's going to have to be reformed. So the Republicans looked at this and said, we see what they did wrong, we're going to do that too. Because those provisions that are screwing up the Affordable Care Act are very popular politically. You go out and, I mean, you poll things like, would you like, do you favor allowing insurance companies to discriminate against people with cancer? Hell no, nobody wants to let insurance companies do that. I mean, you know, aside from the fact that we all have to think, just, you know, think about the TV. You know, nightly news, every night, you know, we'll have some poor woman on, you know, she just got diagnosed with breast cancer. And because of that, she lost her job because she couldn't work anymore. So now she's sitting there with her 3 special needs kids and waiting for her husband to come home from Afghanistan where he just lost his leg because of an IED. And they turn to someone like me and they say, why do you want to take away her insurance? And that's a hard one. So the Republicans looked at this and they said, okay, we're going to repeal Obamacare, except for that part where insurance companies can't discriminate against people with pre-existing conditions. They figured that look, they could be a little bit pregnant on this issue. Unfortunately, that doesn't usually work. So having decided they were going to do that, but they were also going to repeal the individual mandate and repeal the subsidies for this. Well, what did they think was going to happen? Healthy people were going to, even the healthy people that managed to, they did sign up under the Affordable Care Act, were now going to drop out of the system. When you look at it, you saw numbers, I'm sure you saw the headlines, 16 million people lose their health insurance under the Republican proposal. Anybody see that headline? 16 million people weren't going to lose their health insurance. In fact, almost nobody was going to lose their health insurance under the Republican proposal. 16 million people were going to not buy health insurance because they didn't have to. Because they were young and healthy and decided to take the risk themselves rather than buying a lousy insurance plan because they no longer had to. All this was going to do was make this adverse selection death spiral worse and happen sooner. So that's where Republicans screwed up number one. They tried to keep that, and they played some few games to try to deal with this. They had a provision in there that said, well, if you were uninsured and then you tried to buy in after you got sick, you had to pay 1 year, you'd have to pay a 30% higher premium that 1 year. Unfortunately, they also said that even if you're healthy and you were uninsured and you tried to buy insurance, you had to pay that 30% premium hike in 1 year. So that means that the healthy people who decide to go uninsured are going to stay uninsured because they don't want to pay 30% more. And besides, it makes no difference. Once you get sick, then you can buy the insurance still. The company still has to cover you. But why would you buy health insurance when you're healthy if you can simply wait until you get sick and buy it then? I mean, Forrest Gump wouldn't make that choice. So they screwed that up. Second thing they screwed up, they said, okay, well, having done this, we're still going to, we still got to find a way to get young people or healthy people to buy insurance. We're going to have to come up with some subsidies. And then, but we don't want to spend a lot of money on these subsidies, so we're going to cut them back. And so they did away with subsidies. It's hard for me to imagine what they were thinking here. But they said, we're going to do away with subsidies that are based on income. So we're no longer going to give big subsidies to poor people and lesser subsidies to wealthy people. That's the way the Affordable Care Act worked, was the poorer you were, the more subsidy you got. We're not going to do that. Instead, what we're going to do is give you a subsidy based on your age. And the older you are, the bigger the subsidy will give you. And I guess there was some logic to this, because as you get older, your premiums go up because you're generally sicker and you use more insurance, so I guess your premiums are higher than what you, so I guess there's some logic to that. The other big logic to that was the group that votes most often for Republicans are older white men. So when it came time to give benefits to somebody, they said, let's give a lot of benefits to old white men. And young people who voted 80% for Hillary Clinton, hell with them. The way Washington works. So having put this together, they couldn't pass it. They basically made everybody unhappy. Moderates looked at this and said, wait a minute, you're taking away subsidies from people. They're going to play with Medicaid in order to save money, and I'm not even going to try to go into the incredibly complex system they had developed for Medicaid, under which there was a series of competing caps that states could choose, a per capita cap or a per usage cap that was cut back to 2016, but they could enroll people until 2020, and then they had to cut those people back over time, and it was incredibly complex, and it was designed entirely to fit within certain budget rules that they have to play with in Washington. But they made the moderates unhappy with the Medicaid changes, with the cuts in the subsidies, with the fact that in order they were going to let people buy insurance that didn't have the mandated benefits package in there. And they made conservatives unhappy because they were maintaining this pre-existing condition exclusion. They were keeping subsidies that were still going to be fairly expensive, and were kind of setting it up to be a new entitlement. The result is that they ended up having to pull the whole thing just before the vote. I can also tell you that they had certain problems in trying to negotiate this bill. As I say, they only had 7 years. So they rushed down to the White House to try to negotiate this bill, and found there were two distinct problems. One was that the president had no clue about health care. And people who were sitting in the meeting said, they would raise specific issues like, well, how do we treat pre-existing conditions? And the president's quote was, so I'm going to quote him on this, was, stop sweating the small shit. Just get this done and think about the big picture. That's not the small stuff, folks. That's the fundamental issue. The other thing was the president thought he could just tell congressmen what to do. The day of the vote, the president sent Steve Bannon up to Congress, and he called in, they met with the Freedom Caucus. And he said, and this is a quote from Steve Bannon, was, "This is not a debate. You will vote for this bill." To which one member of the Freedom Caucus said, "The last time anyone told me what to do, it was my father. I was 18 and I didn't listen to him then either." The result was they pulled the bill. There was no vote on this. We are now told that, in theory, they're going to come up with a new bill by next week and hold another vote. Probably not. At some point, they're going to have to do something. They're going to have to do something on a policy basis because the Affordable Care Act is collapsing. And they're going to have to do something on a political basis because every Republican who ran for anything, including dog catcher, said they were going to repeal the Affordable Care Act when they were elected. It's very difficult for them to say, yeah, look, we made this promise for 7 years, but look, we worked on this for 17 days, we couldn't do it, so the heck with it. Probably not going to get there. But what I'm questioning now is whether they understand the fundamental question involvement here. And that is that markets work when they're allowed to work like markets. And that means you have to have consumers who spend their own money, and you have to have individuals who make choices, and you have to have competition from the providers. The bill that they came up with did not provide those things. It sort of papered over the market with what they called free market reforms, which really didn't change the underlying premise in terms of health care. What we're going to have to do, ultimately, is take people who are uninsurable out of the market because they're not part of the market. And we're going to have to pay for their health care in some other way. There's a lot of ways you can do that. There's risk pools. You can expand the Medicaid program, which is what Rand Paul has suggested, is that we simply give the states a lot more money. We tell them that they cover both low-income people and pre-existing conditions, because Medicaid already sort of pays providers directly. That's what we would have to do for people with pre-existing conditions, is pay their provider, pay their doctor directly. But we have to take them out of the system altogether. Then what we have to do for the people who remain in the system is allow more choice and more competition in the marketplace. Ultimately, I look at healthcare. People often ask me, they say, is healthcare a right or a privilege? And my response to that is it's neither one. Healthcare is a commodity. And it's a finite commodity. There's only so much money, so many doctors, and so many hospitals. Right? No healthcare system in the world provides unlimited healthcare to everybody, no matter what Michael Moore might say. They all ration care in some way. They ration it by fiat, they ration it by Q, they ration it by price, which is what we do here, but ultimately everybody rations healthcare in some way. When you try to avoid that, when you try to insist that we're going to cover everybody for everything, which is essentially the politically popular thing to do, you end up with a system that doesn't work. Ultimately, what you're going to have to do is create a system in which people act like consumers of healthcare, consumers of any other commodity. Not to make myself sound quite as old as I am. Well, I won't even have to talk about me. How about, did anybody seen the movie Hidden Figures? Great movie, you should all see it if you haven't seen it. There's a scene in there where they moved the new IBM computer into NASA. It's a room. It takes up an entire room. And it runs on these little punch cards that they put in. And the people, nobody knows how to program it, and it's so slow that they actually have to check the calculations by hand with slide rules and stuff, and adding machines in order to make sure the computer got it right. Today I've got a computer that's about 1,000 times better. Got it right here, and they didn't even charge me for it when I got a 2-year contract. Why? We didn't have the Affordable Computer Act. What we had was millions of consumers who demanded better quality and lower prices. Why don't we have that in healthcare? Because we don't have consumers spending their own money. We don't have providers competing for that money in the market. Unless the Republicans understand that fundamental truth, as long as they continue to try to be sort of halfway pregnant on healthcare reform, where they're going to take a little bit of national healthcare, a little bit of markets, and try to cut the difference between the two, they are going to fail as a matter of policy, and they are going to fail as a matter of politics, because they're going to produce something that doesn't work, that they own, that they are going to be, the American people are going to be unhappy about, and they're going to pay a price for that at the ballot box, and the American people are going to pay a price in lousy health care and high costs. Thank you all very much. I appreciate you listening to me. All right, so shoot, questions. And shoot, I don't mean literally. I know I'm in an open carry state, so. Anyway, left everybody in stunned silence, depressed. Yeah.
What options do they have from like a administrative standpoint that would not have to be applicable?
Two questions. Two big things they can do from an administrative standpoint that'll help. That won't fix the big underlying problem, but will help in the short term. One is they can lighten up on the enforcement of the individual mandate and also of the essential benefits package. The law specifies certain essential benefits in terms of mammograms, hospitalization, drug and alcohol treatment, mental health benefits, a bunch of these things are actually specifically mandated in the law. They can't do anything about those. But it also gave the Secretary of Health and Human Services the power to determine other benefits. And they actually had a big thing out at the Institute of Health where they had people come in and testify about why their benefits should be included and all that. And then they laid out a whole bunch of other benefits. Tom Price, the new Secretary of HHS, can simply do away with those other benefits as well. That'll help bring down the premiums to some degree and make it more affordable for people to buy in. There's also an important court case that has to do with insurance subsidies to the insurance companies. Where essentially there's a big bailout for the insurance companies contained in the Affordable Care Act who are losing money because the system, as I said, set up to not work. So what they're trying to do is bribe insurance companies, pay insurance companies to stay in the market. These subsidies have been held illegal by the courts because of the way they're designed. The money was never appropriated for them. I don't want to get into all the technical budgetary stuff. But that case is proceeding through I believe it's at the third court levels held that those subsidies were illegal. They're being appealed now. The Trump administration can decide not to defend against that appeal and simply let those subsidies go away. That would again help. That would save a lot of money. It would stop the bailout of the insurance companies, which I think is just corporate welfare, and it would also speed some of these questions that we're going to have to face about the DESFire that are being sort of papered over by these subsidies right now. So I guess those are administrative decisions that we'll have to wait to see what they do on those things. Yeah.
Yeah. So like car insurance, how you like joked about like how everybody got car insurance. So like what's the difference between like the car insurance and like the health insurance? How are they able to like maintain and function?
Yeah. So two good questions on that. First, people talk a lot about the mandate that people have car insurance. I would differentiate it in a couple of ways. First, I would say the mandate on car insurance actually doesn't work very well. In every state in the union, this was a couple of years ago, so it might be off by 1 or 2 states today. But as of a couple of years ago, in every state in the union, the 49 states that require mandatory car insurance, Vermont does not. So if you don't have auto insurance, you can go to Vermont. But 49 states require that you have auto insurance. In every one of those states, more people were uninsured drivers than didn't have health insurance. In some states like Texas, it's 25% of the population doesn't have auto insurance, despite the law that says everyone has to have auto insurance. So it's actually a pretty poorly, the mandate shows that even with mandates, people don't necessarily buy these products.
Okay.
Second, you only have to have auto insurance if you drive, if you have a car. The difference with this mandate was a mandate, it's the only thing that I think is mandated except the draft that you have, or selective service for men, that you have to do, government mandates you do simply because you're breathing. No other requirement other than that you be an American and be breathing, and you have to buy the insurance. It's really unprecedented in its scope in terms of defining the role of government and the role of the citizen and what they can make you do. And so I have a lot of problems with that as a way of governing and with our relationship to the state. In terms of why auto insurance markets work, auto insurance don't have essentially community rating. If you have a bunch of accidents, your auto insurance company could raise your rates. And they also, you can't wait until you get that accident to buy the insurance either. You don't get covered. But they were trying to do that's an actual insurance market. By the way, just talk about insurance, what insurance markets look like. The very first, I don't know if anybody knows this, the very first insurance company in the United States was started by Benjamin Franklin in Philadelphia. He started a fire insurance company, a homeowner's policy for fires. And he charged you more if you lived in a wooden house than if you lived in a brick house. Because a wooden house is more likely to burn down, right? They tried, you get the same thing in an auto market. If you have 3 speeding tickets and you banged up your car twice, you're going to pay more than somebody who's got no accident. If you're afraid, if you're a young man, you're going to pay a lot more than an older woman for insurance because you're more likely to be in an accident actuarially and all that. I do think they ought to change it after you get over to be about 50.
Yeah, that's fine.
But statistically, I think it's young men 18 to 26 are the most likely to crack up their cars, and they pay more insurance. They're doing away with all that insurance stuff in the ACA. Basically, they've eliminated the idea that you manage risk in insurance, and that's what insurance is. It is the management of risk. Yeah.
You would say that you don't believe that healthcare is either a right or a privilege.
Right.
So what is your response to the argument that government should not be involved in healthcare whatsoever, that it should totally be privatized industry?
Yeah, I actually think it should. I think that's correct. I mean, I don't think government belongs in healthcare. Now, that's a slightly different thing from saying if government shouldn't help people to buy healthcare. But I'm saying if people can't afford healthcare, they have an income problem, not a healthcare problem. I think that the insurance market or the healthcare market is actually a very inefficient mechanism for redistributing wealth. If people have an income, well, we can talk about whether or not you need to redistribute wealth because people have an income problem. But using the health insurance system to do that is pretty inefficient. If you actually look at the Affordable Care Act, it redistributes money from young people to old people. By and large, young people are poorer than old people. I mean, basically, somebody who just gets out of school and gets their first job is paying a higher premium in order to lower Warren Buffett's premium. What sense does that make? I mean, that's not a very good, not a very efficient redistribution mechanism. So I think if you want to do it, let's leave health insurance entirely alone, let the market work. And then if we have to redistribute wealth in order to deal with people's income problems, let's do that separately out of general revenues, and transparently that we're going to give people money. Let's do that whatever way we're going to do that, but do that separately from the system. By and large, I think that's ultimately the way I would go. Now, you may have to deal with some mechanisms to say for these exceptional cases of people with pre-existing conditions, which is a small, very small population. I mean, you'll see huge numbers of people with pre-existing conditions that are out there, but that's not what they're talking about. Is not people who are uninsurable. I mean, everybody has a pre-existing condition. I have a pre-existing condition. I have health insurance. I had health insurance before the Affordable Care Act, even though I had a pre-existing condition. I mean, virtually everybody has one. You can come up with any number you want. I'm talking about people who are actually uninsurable under the marketplace. They're going to have to give them, again, it's an income problem. You have to give them enough money to be able to pay their doctor. So that's essentially what I would do on that. Yeah?
Can you explain to us how the employer mandate is actually working?
Yeah, the employer mandate is a requirement essentially that businesses with 50 or more employees have to provide health insurance to their workers. It was postponed repeatedly. Now we should start with the idea that almost any big company already provides health insurance to their workers. So the employer mandate had no impact on companies that had 100 or 200 employees or things like that. They almost all covered everybody. So it really had very little impact there. It was primarily smaller businesses, let's say 50 to 100 or 50 to 150 that were the ones that were hit most. They pushed back that mandate, when the effective date of that mandate repeatedly. So we don't have a lot of data to really understand exactly how that's having an impact. We do think that it has largely shifted workers from full-time. It hasn't necessarily cost employment, but it has cost full-time employment. What employers are more likely to do is hire people under the hours threshold so they didn't have to offer the insurance rather than make them full-time work and have to pay the insurance. So originally, and I was after one, originally when they passed the law, I thought there was going to be a significant increase or decrease in employment because of this. I don't think I was right about that. I don't see the evidence to suggest that employment has significantly been cut because of the Affordable Care Act. But I do see evidence to suggest that full-time employment has been reduced, and what the people have done is move to part-time employment under that, which begins to make a certain amount of sense. And I can tell you one place that's accepted folks your age at the Cato Institute. We bring in interns, and we actually pay our interns, unlike a lot of places in Washington. Because we pay our interns, we now, under the Affordable Care Act, if they stayed with us more than 120 days, we'd have to give them health insurance. So we kick them all out at 119 days. We used to let people, we used to have like 160, 170 day intern program. We could stop paying them, and that was fine. But as long as we want to pay them, we have to kick them out like at 119 days. So that's the sort of thing that goes on. Yeah.
You mentioned different countries of the world and they use universal healthcare, and that different countries use different methods of professionalization of healthcare.
Yeah.
But you mentioned also that there is no country that was able to successfully implement this universal healthcare. But talking of countries like Germany, Denmark, Norway, Sweden, they are like this type of healthcare what kind of work obviously better than in this country. So what is the difference that allows them?
Well, it depends on what works for you. Do they cover more people? Yes. Do they cover people for everything? No. They all ration care. And rationing, I say, takes place in 3 different mechanisms, basically. And there are different mixes of these mechanisms between different countries. You can ration by fiat, which is what the United Kingdom does, Great Britain, or the Scandinavian countries that you mentioned, Denmark and so on. They all ration by fiat, which basically says, we'll provide this type of care, but not this other type of care. And you can't have this other type of care. It's not cost effective, we don't find it useful, or whatever it might be. In Britain, they have a group called the National Institute for Clinical Effectiveness. NICE is the acronym. I don't know who came up with that. It's a marketing guru. But essentially, if you want to introduce a new cancer drug, let's say, in Britain, it goes to NICE, and they determine is it cost effective to allow that on the market. And right now, the cutoff is 80,000 pounds per year of life. So if this cancer drug will extend on average people's lives by 1 year, as long as it costs 80,000 pounds or less, you can market that drug in the UK. If it costs more than 80,000, they don't allow it. That drug's not available. You can get it in the private system, but not through the national health system. So there's that type of sort of fiat rationing from the top down in those countries. Second type of rationing is rationing by queue. And this is the type of thing that goes on in Canada, let's say, and in some of the southern European countries, Italy, Spain, and so on. There's no prohibition on what you can have, but there's so few. They do so few hospitals and so few types of new technology and so on. You have enormous waits for certain types of treatment. You can have that. You can have your hip replacement surgery, but you have to wait 18 months to get it. Type of thing. And the third type of rationing is rationing by price, which is what we do in the United States. If you can afford it, you can have it. If you can't afford it, you don't get it. They all ultimately do the same thing. And let me offer a thought experiment to everybody here. This is when rationing comes up. This is the type of question. This is the type of thing I'd like to ask. Let's assume that every American got a physical every year. And as part of that physical, you got a CT brain scan. We would catch a couple of dozen cancers, brain cancers, early enough to save those people's lives every year. A couple of dozen people. And and every life is priceless, right? But we'd also bankrupt the country overnight because it costs about $1,000 a pop to do a CT scan. Imagine 350 million Americans doing that every year. No country in the world is going to give every one of its citizens a CT brain scan every year to try and catch those brain cancers. They're going to ration. How are they going to ration? Some countries, like Scandinavia or the UK, would simply say, you can't have a brain scan. Spending that $1,000 on a brain scan when there's an infinitesimally small chance of you're having brain cancer is not efficient use of money. Think of all the people we can give vaccinations to or do other better things with if we spend that money elsewhere. So you can't have that brain scan. Canada, they would say you can have a brain scan all day if you want. Many brain scans as you want. Okay, there's only one CT scanner in the province of Saskatchewan, so it could be a bit of a wait to get in. And we say, costs $1,000 for that brain scan. If you want to have it, pay $1,000. Okay, which of those three is correct? I don't think there's an answer to that, at least not economically. Morally, it's up to, people have different sets of values. Which of those three is the correct answer? I tend to side with the U.S. system because ultimately it leaves that choice with the consumer. Because yeah, the chances of you having brain cancer are really small. But suppose your father died of brain cancer and your uncle died of brain cancer. Maybe you would just sleep better at night if you had that scan and it was negative and you knew you didn't have brain cancer. You'd just feel a whole lot better. Maybe that's worth $1,000 to you, just to sleep better. Shouldn't you be able to make that decision and decide to pay $1,000 for it? Or should some arbitrary agency come in and say, no, you can't have it no matter what? Ultimately, that's why I think it's individual choice, individual decision, and freedom that makes the real choices. But that's the end. Everybody's going to ration. Every system in the world is going to do rationing in some way, because nobody can provide unlimited care. Anybody else? Okay. Yeah, next to you, and then I'll go over here again.
Well, it's inevitable that the Affordable Care Act, like you said, is going to crash.
Yeah.
It's going to explode.
Ugly.
Yes. Do you think that it's possible, like many other government programs before that have failed, that the government would just turn into a budget deficit and instead of letting it explode like it should, and just
hell yeah. Look, Social Security is crashing and burning. There is no way that you are going to get the benefits that you're promised under Social Security. No way. Social Security is $32 trillion in the red. See anybody in Washington rushing to fix the problem? So yeah, they will duck this and dodge it as long as they possibly can. They will paper it over. They will subsidize it. They will do anything other than actually face up to the choices that they're faced with. Yeah, national interest, cowardice of politicians, balancing the two. Yeah. No.
Yeah.
All right. I'll come back. I want to give someone else a chance. Anybody else? Going, John.
You mentioned that like market forces, like competition, are able to bring like such commodities, healthcare,
yeah,
or like the phone industry, whatever, to make it affordable to everyone during the time. But for instance, talking of computers, like such, like computers became available to most of the people only the passage of time, but healthcare is required to some people instantly. What about those? Since healthcare is pretty expensive, what about those?
No, and you're absolutely right. And there will be a transition period, and there will be look. There's going to be losers. One of the things that bugs me about politicians is that any kind they propose never has anyone who wins and loses. Everybody's going to benefit. When they passed the Affordable Care Act, President Obama came out and said, everybody's going to be better off. Donald Trump says his new plan is going to be great and wonderful and beautiful. Nobody's going to lose. Of course people are going to lose. There's always winners and losers. We want to minimize the number of losers, maximize the number of winners. But there's always going to be people who are worse off. Because we don't live in utopia. And all I can do is try and come up with something that minimizes the number of people who are going to be worse off. And I think under the current system, more people are than under the revised market-based system. But particularly, there's going to be transitions. Transparency in pricing isn't going to happen until there's lots of consumers just spending their own money. You're not going to see lowered prices until you have massive penetration of the market by like that thing going on. And people used to complain I've seen a lot of complaints that we have health savings accounts designed to get people to spend their own money. And people would say, well, we have health savings accounts and prices haven't gone down. It's true, but not that many people have health savings accounts. I think it's like 20 million people nationwide. Well, you spread those all out, you know, you have Midland and you have 20 people in Midland who have a health savings account. How much impact do they really have? Now, when you get a concentration, it makes a difference. Indianapolis, great example. They were the home of Golden Rule Insurance Company, which was one of the first companies to ever offer, back then it was called medical savings accounts, became health savings accounts. They offered them to every one of their employees, which was like the 5th largest employer in the city. There's like 5,000 people that Golden Rule had them, and their families had them, and then they sold them to other people and marketed them in that area. And they had a big market penetration, to where like 20% of the city had health savings accounts. This market did respond. You saw hospitals doing things like Mother's Day specials, $25 for mammograms, and things like that. I mean, people responded and acted like it was a market when you got that penetration. But it takes time to build that up. And in the meantime, yeah, it's going to be rough. I give a lot of advice to a lot of medical companies, and they say, what's the healthcare market going to look like over the next 10 years? And I said it's going to be a mess. ACA stays, ACA goes, it doesn't matter. We're going through a period of turmoil. And that's just going to be a mess until things smooth out. And no, I'm not the grandest optimist in Washington. That's for sure. Anything else before I bring it to a close? Yeah, in the middle.
How much effect can institutions like yours have on policy?
I think we do over time. You know, I mean, I think in terms of, for example, health savings accounts was an idea that we largely popularized. It was actually created by Stormy Johnson, who was with the American Medical Association, wrote an article, a journal article in 1965 or 1975, something like that, talking about what became health savings accounts. It was picked up several years later by John Goodman of the National Center for Policy Analysis in Dallas. We then published a book by Goodman that publicized it heavily in the 1980s, and it gradually moved into policy mainstream. It was institutions that promoted school choice and brought those ideas to the public. Charles Murray's book on losing ground in terms of changing perception on welfare. So they do change, but it takes time. You know, come out with a new idea today, it's not going to, no one's running down and passing the law. These things take a lot of time to pass on both sides. I would say the left as well. You know, they fought for national health care since Harry Truman. You know, and they still haven't got his universal coverage. Bernie's still out there proposing $30 trillion proposals that aren't going anywhere. Thank you all very much. Really appreciate it.